we would like today to be a chance for everybody to think about how this new resource might be useful for you in your work. And we'd really like a steer from you in this session about what else you might need and what we should do next. This is definitely a work in progress. It's not the perfect resource by any means, and we need your help to populate it a bit more. So for the first 30 minutes or so, we're going to have a discussion with a few colleagues, and then we'll have some breakouts after that where everybody can talk about their own work and how this relates. Our panel is, I'll just tell you who they are and then I'll introduce them as we go through. First up, we're going to have Farah Ahmed from Julie's Bicycle, who's the climate justice lead at Julie's Bicycle. Caroline Moore is here from Great Ormond Street Hospital Arts. Guy Noble and Laura Waters, who co-chair the National Performance Advisory Group for Arts, Design and Heritage in Hospitals. Anna Woolf from London Arts and Health. And Alex Coulter from Arts and Health Southwest, and also the National Centre for Creative Health. So this resource was built through a consortium with Arts and Health Southwest, London Arts and Health, and the Hospitals Network. And it came about because of the Julie's Bicycle Accelerator programme that we've been part of for about a year. I'll talk a bit more about the content later, but for now, I just wanted to share the sort of overarching principle, which is, of course, that creativity, climate and health are interconnected. And in particular, climate justice and health equity are urgent intersecting issues. As we know, climate change impacts everything from mental health to respiratory health, and it also affects people unequally. So we know that within our membership and beyond, many creative freelancers and organisations already take a very holistic approach to health in relation to community and environment and equity. I'm sure lots of those people are in this room. We've created this resource because we think that as more and more people do this, it'll help us to imagine a new kind of future, and it'll empower the people that are trying to make change, as well ultimately as reducing demand on energy hungry health services or aspects of the health services that are particularly polluting and energy hungry. So I'm going to hand over now to Farah, who's going to give you some context about Julie's Bicycle. Over to you, Farah.
Hi everyone. So hello, I'm Farah Ahmed. My pronouns are she, they. For the audio description, I am an olive-skinned South Asian person with sort of short, curly blonde hair. I'm sitting in a room in front of a pink wall and a white door and a big weeping fig plant behind me. So I'll tell you a little bit about Julie's Bicycle for those of you who don't know. I think there's quite a few of our very good friends in the audience that I can see already. But for those of you who aren't aware of Julie's Bicycle, we're a charity who are mobilising arts and culture to take action on the climate and ecological crisis. We were founded by the music industry in 2007, and we now work across arts and culture, partnering with over 2,000 organisations in Britain and internationally. My role at Julie's Bicycle is Climate Justice Lead. So I'm supporting the events and the Creative Climate Justice Programme. So we develop resources, training and advocacy, and support for organisations to connect environmental, racial and social justice and creative activism. I'm really excited to see the hub, the toolkit that Culture, Health and Wellbeing Alliance have been working on come to life. So we've been working on this together through the Accelerator programme, which is a sort of a programme through the Arts Council England Environmental Sustainability programme, and it's really about scaling action on climate crisis, on the climate crisis. It's you know, really important, and what I really love about this is seeing these really exceptional case studies and these really practical ways of moving forward. As Victoria mentioned, you know, the climate crisis and public health are very deeply intersecting issues. The climate crisis has huge implications for public health, for mental health, for people with disabilities, and it's really important that we move from thinking about these issues in a very abstract way, or from, you know, making incremental shifts into these really practical, multi-pronged, holistic approaches. And the final thing that I'll say is that Julie's Bicycle has just launched a creative climate justice resource hub, which features about 120 resources from all over the world, which explain, which show climate justice in action. And you know, health is one of the themes that we look at through there. And yeah, I'm going to be including this toolkit on that resource hub. So please do check that out on the Julie's Bicycle website as well.
Thanks, Farah. That's so helpful. And I've just included the link for that resource as well. So we can do some mutual resource linking stuff. So I'll tell you a little bit more about the resource that we've built. We've put this together because we want to help creative and cultural practitioners directly address these interconnected issues, as I've said. We are particularly interested, though, in accelerating work that creates concrete change at a local level. And we've built the resource through a couple of means. First of all, we've been running a climate award that some of you may be aware of for the last couple of years. We've been partnering with the Happy Museum Network and Culture Declares on that. In fact, we are launching this year's awards on Friday. So if anybody would like to come to that launch on Friday, please do. Hayley, if you can share that in the link as well, that would be great. The awards have been a really useful source of information for us because we get this really strong shortlist every year, and we use those as a kind of set of case studies and great examples of where this work is already happening. But we have noticed through the application process that it's been quite hard for people to make joined up arguments. And I think we're all familiar with the way that funding systems and commissioning systems tend to push us into quite siloed ways of discussing this sort of work. So we want to try and develop a more joined up way of talking about creativity, climate and health, and moving those projects forward. The second source of information then was a series of conversations with 5 organisations. We're going to hear from UCLHArts shortly, who were one of the organisations we spoke to. We also spoke to May Project Gardens in London. Some of you might remember them from our conference last year. Museums Northumberland Bait. We also spoke to North Edinburgh Arts and to the arts team at University Hospitals Bristol NHS Foundation Trust. So we were trying to look at how this work operates in community organisations and also in hospital contexts. And we looked at the barriers and enablers for work that joins up creativity, climate and health. So you could see it as a very small pilot study, and we'd really like to do more of this. We worked on those conversations with Frances Northrop, who may or may not be in the room. She's an independent researcher, but also a research fellow with the New Economics Foundation. We're really grateful to her for her help there. These are some of the recommendations that we came to. Well, I say recommendations, really that we've called them ideas because recommendations feel slightly too strong a word at this stage because of the limited amount of evidence we have. Nonetheless, some themes did come through. First of all, for practitioners, this is meant to be very light touch and in reverse order. We want to encourage people to build relationships with other organisations locally to help support local solutions. So North Edinburgh Arts is a great example of this. They're part of a local action group that brings together a number of community organisations working to make positive change in relation to climate and other sort of social determinants. We also want practitioners to make use of the tools that we are starting to provide on the site. And in particular, we'd like people to feel confident with deploying policy and government commitments, for example, when they're making the case for funding or for partnership work. And this is an area where we need your help. So we know there's a lot more out there that we don't know about. This is not really an area of expertise, although we're learning. but we'd love to build this section of the resource. So if you are aware of policy commitments or toolkits for this kind of work that we can share, please do share those with us. You can put that in the chat during this session, or of course, please feel free to email us afterwards or tweet it at us. I'll probably do a social media thing on this soon. Secondly, for people who invest in this work, we think there's a case for trying to develop more equitable relationships between grantees and grant-giving organisations, or between other investors and the people doing the work. And this is going to make it easier to develop the kind of intersectional thinking that informs this work, and again, move us on from that slightly siloed way of operating, where you can either support health or you can support climate issues, but it feels uncomfortable in some cases to be trying to do both things together. Another barrier that we came across for the people we spoke to was about extending influence beyond the immediate project and building partnerships. So we think there's a place there for investment. We also think funders could be showcasing a lot more of this kind of joined up work around climate and health. And lastly, we make a suggestion that funders prioritise embedded programmes that support local change over sort of showcasey big public events. Lastly, in relation to local authorities and health structures, one of the themes that came through was this sense of, as a small community organisation in particular, of feeling a bit alienated from larger structures. And we noted that a key enabler was the leadership that you get, as with creative health generally, from passionately committed individuals who are taking a risk on working innovatively. And we really want local authorities and NHS Trust, for example, to be inviting these people, these innovators, to strategic conversations. We also suggest that some of these larger organisations could be investing in smaller groups and freelancers to come together to share responsibility, resources, skills. There's some great examples of this already happening. Manchester Museum is a great example of that. And Bristol Hospitals also represented a good case study where something similar is happening internally in the Trust, where the sustainability and arts teams are working very closely together. So this is some of the stuff that's on the website. There's some case studies there. As I've said, we've got some policies and commitments, some toolkits, and we really need your help broadening that. There's some great stuff here, but not enough yet. And with that, I'm going to stop sharing, and I'm going to hand over to Caroline as one of our case studies to tell us a bit more about her work at GOSH. Over to you, Caroline.
Hi everybody, thank you Victoria, that was really interesting. So I'm head of arts at Great Ormond Street. I job share with Viv Rice, who's on the call as well. And I'm just going to tell you a little bit about what we have done previously and what we're going to do in terms of climate emergency going forward. So GOSH declared climate emergency in July 2021, and in doing so we were the first London hospital to commit to net zero by 2030. The World Health Organization estimates that only over 80% of the illnesses, injuries and deaths due to climate change are in children. And even if that wasn't true, our responsibility as a health organization to address climate change, the impact that we have as a very carbon hungry organization, and the impact that has on the planet and the people we care for, is a key responsibility that we need to respond to and address. So as an arts organisation nestled within a health organisation, we're very uniquely placed to use creativity to engage our colleagues, the children and young people we work with, and their families in critical discussions around climate and ecological crisis. We can use creative approaches to flatten hierarchies, to change people's ways of thinking and behaviour, and most importantly, empower them to act. So over the last 3 years, we've focused our programme around the themes of nature, biophilia, sustainability and community, which for me, as Victoria has also sort of said, in many ways are very interchangeable themes. So to quickly give you a couple of examples of projects we've done in the past before we look at the future, and I will post links to these as well in the chat when I'm finished. In 2020, we worked with Something in Sun to think about how we could use how we could nurture biodiversity in the hospital. So children and young people and staff came up with a whole sort of compendium of blue sky thinking, and it was very blue sky thinking, from turning an infusion stand into a bird feeder to releasing peregrine falcons around the hospital to manage unwanted rodents rather than bringing in pest control. So very playful. Another example was Honey Scribe's I can't say this right, Flora, I'm not even going to try to say it. It's a project which invited staff to collect wildflowers during their lockdown walks and breaks. And she then turned these into a really beautiful artwork which travelled around the ward so that children who couldn't go outside could still engage with the total majesty of what nature was offering at that moment in time. So looking forward, over the next few months, we're going to be putting together a manifesto for sustainable working, which will look at some of the following themes, and these will go on to inform all of our future programming, and we will share this publicly as well once we have finished it. So the top point in this is that we'll be programming using a degrowth model. So degrowth is based on the principle of awareness that we live in a very finite world with limited resources, which means that only a reduction in global production and consumption can ensure the preservation of the planet and humanity. We've been given a really unique opportunity by COVID to stop and rethink, and we're really grabbing that with both hands. We're not going to be going back to business as normal at UCLHArts, but we're going to be thinking about what is truly needed in the hospital and why, and what the long-term impacts of some of those projects could be. So we hope that our programming going forward will be much less about quantity and filling the boredom gap, which many of our very excellent colleagues are much better at doing than we are. But it's going to be more about critically engaging with particular challenges that we face in the hospital, such as end of life, or how we overcome the intense isolation, social isolation that children and young people face when they're undergoing bone marrow transplant, or how we can improve the well-being of staff through embedding creativity into their day-to-day work. The next thing we'll be looking at is our materials and supply chain. So we know that there's no such thing as sustainable, as everything we do will most likely have an impact on the planet in a negative way, but we can put certain things in place to reduce that impact. So going forward, we're going to be really carefully thinking about the materials we use in our programme and where they come from. We won't go for the fastest, cheapest or easiest solution or supplier. And we recognise that this will have an impact on our productivity, but it also connects through to our commitment to degrowth. So we don't just want to be going. We need to be modelling good practices for children and young people, for the hospital staff, and also for the artists that we work with, which will ensure or contribute to preserving the planet in some way. Our next theme is around nature-focused programming. So we're told time and time again by children and young people, I was literally told it this morning, how important nature is within the hospital environment. But due to the challenges around infection prevention and control and the fact that we're based in central London, we need to be very creative in the ways we bring nature into the hospital environment. So we need everybody to feel a connection to nature, as it is very uniquely placed to help us address climate and ecological emergency, as I'm sure you all know. And in my opinion and experience, the more we surround ourselves with it, the more we're able to see just how incredible and essential it is to both our physical and mental health. So if we can give everybody at Great Ormond Street Hospital experiences that allow them to re-find this innate and essential connection, we will create a community who will be empowered to work to protect it from further damage. So some of the projects will do this in a very subtle way, just by creating access to green spaces and hopefully planting that seed for people. And others will be more overt. So for next spring equinox, we're planning a green parade, which we're imagining will be a much bigger statement on a potentially national level made to the people who have the power to act and protect our future. And then our last theme is around community. So as a health sector, we're one of the biggest polluters in the world, and therefore we've got a huge environmental responsibility globally. But as the old saying goes, think global, act local. So going forward, we're planning to work much more closely with our local community in what we do. So locally, we know that we have a negative impact on air quality, on noise pollution, and many other things. But we also have the power to use creativity to make the streets around Bloomsbury cleaner, greener, and more friendly places to be. So we're extending many of our projects outside of the walls of Great Ormond Street for the first time. And in doing that, we're going to be engaging our wider community in creative conversations around the importance of working together and through doing so, protecting nature. So ultimately, climate crisis is a health crisis, and it's our responsibility as an arts organisation based within a health organisation to act and empower everyone we come into contact with to do so as well. And we're really excited about the potential that using us as a framework will have on our programming, but also the wider community as well.
Thanks, Caroline. That was great. That was a really helpful overview. There's so much happening with UCLHArts. Yeah, great to hear a little bit more about that, and I hope we can share more of that work as it starts to come through. I am going to quickly ask the other members of the consortium that built this resource with us if they would like to just comment briefly on the resource and how they see it being useful to their members. So we've got in the room the sort of three quite substantial networks for creative health: Arts and Health Southwest, London Arts and Health, and the National Performance Advisory Group for Arts in Hospitals. So since we've just been talking about hospitals, I might come to Laura and Guy first, if that's okay. Whoever wants to jump in, since you're co-chairs, you can mind read and see who wants to speak first.
No, the mind reading is not working. Guy, do you want to speak first or shall I?
Go for it, Laura.
Okay. I think I loved what Caroline said, that the phrase that we're not going back to business as usual really struck a chord for me, and I think that's absolutely how we feel at all our hospitals. And at the moment we're all sort of looking at how we can restart a lot of this work in a different way. And I think having a resource like this at this stage is incredibly useful, because as we start to navigate what our world looks like, I would say post-COVID, just in terms of post-pandemic, obviously we're still living with it, but to have resources like this where we've got all that information in one place and case studies and how we can start to design our work going forward with climate in mind as well, and to have that embedded into all of our work, I think it's really helpful. So that's the real standout for me, that the timing of this resource is absolutely perfect. And as we're working more and more as a sort of a national collaboration of hospitals, and so I think to have this resource nationally is also very useful for us at this stage.
Thanks, Laura. And I think there's a lot more we can do to make sure that it's, that maybe we can get more detail on some case studies as we go forward and try and make those examples really useful and relevant to people. Guy, anything you want to add to that?
Yeah, well, just to echo what Laura was saying, really, and to thank Caroline for her excellent kind of leadership and Gosh's excellent leadership within hospitals. And that idea of a kind of degrowth model is really inspiring for us. And I think as a group, in order to be able to really engage properly with this field, we're going to have to work together. And it's really clear, one of the advantages that the arts can bring is bringing communities closer, and the sharing of resources. And I think if we're going to respond properly in a coordinated way, we're going to have to continue this kind of national approach to working, which is what we as an MPAG organisation are trying to do. From a kind of personal perspective, I'm on a very start of this journey of working with the arts and the environment, and UCH itself has also introduced a net zero target by 2031, and the 10-point plan as part of that. And it's a real kind of challenge to think about how the arts can contribute to that. And I know colleagues working within hospitals always think about how can we use the best of our resources to have the biggest impact for our patients and for our staff. So I know that this resource, having it in one place to draw on the toolkits, to delve a bit deeper, to look at the other kind of resources on there, for example, the Chrysalis Arts resource as well, and keeping it all linking it up together, it's really kind of advantageous to have that evidence to hand and to draw on that and to begin to kind of work in a more kind of coordinated, sustainable way. But yeah, I mean, I think the challenge is with this post kind of COVID climate is to do less, because everyone's asking, raise your profile, what are you doing, what's your new idea? And I think going slowly is the big challenge for us.
Yeah, that's a really important point. Thanks, Guy. We're going to shortly, I'm going to ask everybody to go out into breakouts and carry on this conversation about how this work relates to your work. Before I do that, I'm just going to ask Alex and Anna to jump in with their thoughts. Alex, do you want to go first?
Yeah, sure. I think from an organisational point of view, obviously a lot of us have recently been involved in national portfolio organisation applications. So it's been really useful to have a resource like this to help in our thinking about environmental responsibility and in our discussions with our board, to move away from a sort of data collection mindset and really be able to articulate that intersectional space between health, creativity and the environment. And then more specifically, we've used it in a new project that we're starting, which is a collaboration with delivery partners in heritage and arts and health, and working with young people. So a co-production project working with young people around issues of mental health and loneliness. And that's funded by Volunteering Futures. So, it's how do we then think about the issue of climate in a heritage context and in a volunteering context. And I really liked some of the resources focus on the sort of imagining a different future and working with young people, and they can be very inspiring. So having the case studies is really helpful because it gives us ideas of how to do this in an inspirational way and an imaginative way. And then of course we have our network, so we will be sharing it now that it's published more widely and encouraging others to use it.
Thanks, Alex, that's brilliant. And Anna.
Yeah, thank you. Thanks, Victoria. So I think, I agree with everything that everybody's already said, so I won't repeat. I know we're kind of running out of time. I think for us, it's actually really been reflected in Creativity and Wellbeing Week, like working on this asset with you together with Julie's Bicycle. The theme this year is get creative, get outdoors. And really, we've been overwhelmed by the amount of activity happening all over the country that really embraces climate and creative health, and shining a light, actually, I think I feel very passionately about this, particularly around lone practitioners who might feel actually quite overwhelmed. Like, how do I include ideas around climate justice in my own practice? And so I think this toolkit is just an excellent way to really start, like you said, Victoria, start gathering that evidence and those conversations together in a way that's digestible and manageable, and that we can, support our practitioners to work in these themes and to kind of embrace some of the tools. I'm really excited personally. Tomorrow there's a tool launch from Fast Familiar, which is going to be a really excellent way for practitioners to look at, measuring sustainability in their digital cultural practices. So yeah, it's just such a fab collection, and excited to share this with our network and continue contributing to it.